My name is Brad Jenkins. I'm a nurse practitioner at Uintah Basin Healthcare, and today I want to visit with you a little bit about influenza. The first thing I want to do is clarify what influenza is. Many people, think that if they have nausea and vomiting and throwing up, that's the flu, as they term it, the stomach flu. But in reality, it is not that. It is very much a respiratory illness. Also, there's a difference between the influenza and the common cold. Influenza presents itself with an extremely high fever. It also presents with body pain, sore throat, cough, and as I mentioned, the body pain or the body aches are those of which that people tell me they feel like they've been run over by a truck. And oftentimes they'll ask me to explain what influenza is, and I'll say, it's when you feel bad enough that you're going to die, and then you want to die because you're so miserable. But influenza is one of those things that can be treated if caught within the first 48 hours with an antiviral medication. Often we use a medicine called Tamiflu. So if you suspect that you have these symptoms, it may be wise to follow up or be seen within the first 48 hours. At the same time, we want to start by preventing influenza by good hand washing, not touching our mouth or our nose. And if we do cough or we do sneeze, we cough into the corner of our elbow, preventing further transmission of the virus. Also in prevention, it is recommended that you get the flu vaccine. I know that a lot of people have questions or concerns about that, but the flu vaccine contains up to 3 or 4 of the more common flu strains that are out there. And they try to best guess what we're going to be exposed to within the next year. And so there are times the influenza vaccines are not covering the flu virus that is making the rounds that year. But what I have found in my practice is that there are times when people get the flu vaccine and they still contract the flu. Their duration of the symptoms is much shorter than those who have not had it. So my recommendation is get the flu vaccine, practice good hygiene to prevent it, and then of course if you do feel the symptoms, be seen within the first 48 hours so that if appropriate, treatment can be implemented at that time.